Welcome back, J-Bone.
Feels nice to be two.
It does. It does. It's less crowded.
Less crowded for sure.
Less crowded.
Yeah, Deshaun had to take care of some dental work today.
Right?
Hmm.
Exactly.
I guess you're getting a scrap on the ODRs, I think, right?
We did. We
Hmm.
did, yeah. Some young kid, I think, took him on.
Yeah, a team of young kids, I think. Yeah, but that's what you get for hogging the puck in the ODR.
That's it, let the kids play, Sean.
Seriously.
Jeez, come on. They're only 7.
Exactly. You always got to prove.
Yeah, it's okay. You'll learn. All right, so we're back again after the holidays. Kind of
Yes.
fitting. We're gonna tie in the last episode of our digestive series after subjecting ourselves to too much food.
Yeah, the holidays are great for that.
Yeah, so it's always a good test to see where you're at on the scale. Um, so yeah, so we're gonna do episode 3, which is all on the large intestine.
Mm.
So we did episode 1 where we were covering everything stomach, from related dysfunctions to the stomach, body pains you can experience with stomach dysfunction, and then leading into the intestine, so the small intestine,
Hmm.
in episode 2, about mostly about absorption and its importance along those lines, and the ins and outs of what do some of these represent on a psychosomatic level, but also on a mechanical level, like what does it affect in the body, back pain and shoulder pain and all these various things that can be associated to the digestive system.
Yes.
And that's it. So then, bang, episode 3, right where it ends.
Termination of it
Literally
all.
where it
Where it
ends.
ends. Yeah.
The the large colon. So so yeah. So let's get started with. Maybe we could talk a little bit about the importance of it. Number one.
Sure.
And then we'll dive into its effects on the body mechanically. What are some of the things people suffer from? We'll get into that. We'll get into a little bit of some of the root causes along the psychosomatic aspect of things, and then give you guys some solutions on how you can improve that.
Beautiful. Yeah, so if we kind of dive into the anatomy. So like Kevin said, we left off with the small intestine last time. It ends up in our lower right quadrant in our abdomen. And there's a valve that connects our small intestine to our large intestine called our ileocecal valve.
Mm.
And from there, we have the three main components. Well, there's probably more, but three main components of the large intestine is your ascending colon, which starts in your lower right quadrant, comes up towards your lower right rib cage, and then a transverse colon across your midline to your descending colon on your left side, where it hits your sigmoid colon, and then finally your rectum and out. So anatomically, there's a few important things, mostly fascial, we'll talk about today.
Yeah.
I joke around all the time with even just patients, like we don't really know our insides and where they're located and what they do, but I tell them all they don't just float, they don't just hang
No.
around in there. They're supported through fascia
Yeah.
and connective tissue, which from those fascias and connective tissues attaches them to our skeleton or to our diaphragm or to our peritoneal wall. There's attachment points everywhere. And so some of the main ones we'll discuss today are your told fascias on either
Yeah.
side. We can talk about the sigmoid mesocolon on the left side. And those are the ones that really kind of hold our intestine, our large colon, our large intestine in place and allow it to do what it's
Mhm.
supposed to do,
Yeah.
which is primarily, as we kind of briefed upon in the last episode, is like we had mentioned, about 90% of absorption takes place in the small intestine. And the large intestine is really responsible mostly for absorbing water and a few kind of vitamins and minerals, but mostly it's water. And that's what gives our stool its form, right?
Right.
So like we kind of briefly discussed last time, if you don't have proper absorption in the small intestine, what ends up happening is your large intestine doesn't know what to do because it's not built to break that kind of stuff down. So it typically will give people like a diarrhea, like a quick expulsion.
Get it at.
Versus for the other half, well, for the other, problem area, if you will, if you get into constipation, is that there's usually some these fascial tensions in these told fascias, or perhaps that are kind of creating this environment where the walls of the large intestine are not able to contract as they should, and that peristaltic wave that propels
Mm.
our food or our chyme through our system at that part is greatly diminished, and so then the contents stay longer and longer within and absorb more and more water.
that makes so much sense too when we're comparing, like when we talk about the psychosomatic aspects of the small intestine, the
Mm,
absorption of things, right? So like when you can't absorb things, so they say too that it is a means of getting rid of something. Like an event happens and it's too much and you just want to get rid of it.
yep.
So when it's not absorbed or dealt with, it's it comes out quickly.
Yeah, diarrhea.
Or the opposite, where you're holding on to things, and then you can have the opposite effect of having more constipation and things like that, right?
Yes. Yeah. And you can have
So,
both. Some people have both, right?
yep, they
They'll
flip
flip
flop.
flop before. That's a form of IBS. We call IBS constipation predominant, where they'll have sometimes like constipated things that then they'll have
Yeah,
a movement, and then usually it's followed by kind of like a diarrhea afterwards. So it's really kind of up and down from there.
usually some of those issues are revolving around the ileocecal valve and things like
Hmm.
that. Yeah. Yeah. So that's where the exchange happens between what we're absorbing and what we're getting rid of, right?
Yes.
Yeah. Nice.
So maybe we
Yeah.
can we kind of saved a picture earlier. So for those of you who are not aware, I did my thesis on constipation, and one of the measuring tools I used was something called the Bristol Stool Scale.
Yeah.
So Kev's gonna
Hopefully
bring
you're
that
not
up.
eating right now.
Yeah. So I use this as a way for a very easy, like layman kind of picture, and quite often doctors have in their offices to describe your bowel movements. And in normal digestion, they have seven pictures and seven kind of written descriptions of your bowel movements. And typically what we're looking for is we want to be what's described as a type 3 or type 4 stool form. This normally correlates with like a normal transit time. So transit being the length of time it takes to go through your whole system. So type 3 or type 4 is what you're trying to get towards. It shows that your large intestine is in a healthy state. Um, and that is operating properly. People in my thesis at the time were looking at type 1 or type 2, primarily type 1, where you're getting these round, hard, small little pellets. And as much as they're smaller in size, you think they'd be easier, but they're not. They're actually much more difficult to pass. If anyone's been constipated in their past, I'm sure
So
they can.
rabbits have colon problems.
Right, seriously, yeah. A
Got it.
lot of those rabbits, hamsters, a lot of them do the same thing. But
And you also don't want a large sausage that's lumpy.
that's exactly right. You're closer to type 3, but it's
Got it.
definitely a little more difficult to pass, right? There's usually, so constipation, what does that look like? It looks like, not going more than you need to have several of these to line up at the same time, but, we usually associate it with, frequency, not going often, less than 3 times a week, or straining, or, changing positions, or different things you have to do
Right.
to actually have the bowel movement. And then opposite of that is you look at type 5 to type 7, you'll see that this leans towards more of that IBS or
More loose,
diarrhea,
more
yeah, loose
liquidy.
stools to water to some people, right? So
Hmm.
again, type 3 or type 4 is what you're looking for if you can.
Nice.
Yes.
Nice. Excellent. God, technology, look how good.
Seriously.
Wow. Flawless. Flawless.
Amazing. You're good with that stuff for sure.
Yeah. I don't know about good, but so okay, so why don't we jump then into do we get into some of the mechanical issues that people come in
Sure,
with?
absolutely.
So again, like we said in prior episodes, we were talking about the stomach, we were talking about the intestine and certain attachments it had and what it caused. These are somewhat similar in the sense that back pain is quite often associated to digestive issues,
Yes.
especially like intestinal and colon mostly, whereas stomach is mostly upper, so like shoulder, but it can,
Upper back more
the upper
than,
back.
than lower back.
Yeah, for sure.
Big.
But most commonly, we'll see people come in with SI pain. So lower back pains, often isolated to one side, or it can flip-flop from one side to the other. These are often associated to tensions around. So if you imagine the colon as like a sausage with a lining, so that's what the fascia is. That lining around the organ actually physically attaches into these areas in the inner bowl of your pelvis. Uh, and specifically on the descending side. So if we go, like Jason said, it starts emptying the intestine, the small intestine, into the large on the right side in the lower abdomen, moving up towards your rib cage, across and down. And then where it goes down into the pelvic bowl on the left, well, there's an attachment just before where the sigmoid, which is the curvy part of that descending part, will then turn into the rectum. That attaches right at L4 and L5 in your lower back, right to the front face of it on the disc even.
On the disc itself.
Yeah.
It's called
So
your sigmoid mesocolon. Yeah.
and so that quite often we'll see people with dysfunctions in the lower back related to that being tight. So these are people quite often that have had probably chronic issues with their digestive tract that develop these adherences within the digestion and started to affect how the back moved and everything else.
Yes.
Yeah.
Right SI joint too. We didn't
Yeah.
touch on that last time. That can be kind of a little higher up in the small intestine. The root of the mesentery attaches at your right SI.
Yes.
So same thing, that can give you sacroiliac pain on the right hand side. And just in general, even going back to when I wanted to do my thesis, I'm trying to think, okay, so for all of those of you who don't know, back in the day we had to do theses to become osteopaths. So you had to choose a subject. And I remember thinking, what am I going to choose? And the vast majority of people we normally see are lower back pain, especially back then. I think neck and upper back has caught up a lot with the work from home crowd. But I also then, even back as an AT before I did osteo, you started to see that, man, so many people with lower back pain had digestive issues. And that's because the anatomy is right in front. So it plays a huge role for back pain. It's very, as osteopaths, I'm sure, Kevin, you'd agree, that's very rare that if we're treating someone for low back pain that we're not touching something digestive at the same time.
Correct.
It's such a huge
and or
correlation. And hip, yeah.
Well, we'll see hip a lot, the related neurology between the hip and the colon as well. So where it is in the back, so L2 and L3 region is a key spot for mobility in the back, and quite often is affected if there's long-standing issues with the colon and or you'll see this with hip tensions and things like that too, where people have issues like that. So quite commonly we'll see hip tensions and problems sourced back to something with the colon. I don't know about you, but we tend to find, well, for sure, a lot of stuff with the ileocecal valve, that valve we talked about, quite often either stuck open or stuck closed and having an issue because it is a muscle, so it does open and close and it controls that movement. So it's really important that it moves well. But the sigmoid is quite often one of the ones that's the most adhered in the pelvic bowl. Tends to be a lot of more irritation there for some reason, accumulation, quite often inflamed. Then you got people that have like diverticulitis and things like that can have the inner lining of that has these little folds in it that can get irritated and inflamed, and that's what
lifestyle factors, the foods we eat, the positions we get into, right? A lot of people sit for work, and that sitting, maybe that's why it's a little bit more susceptible, because it kind of goes more transverse again, lower down. So it's kind of getting pinched. It's one thing to do that for a year. It's another thing to do that for a couple of decades at work. Those tensions kind of build, just like a tight muscle can occur from repeated behaviors, if you will.
And then we have on the more psychosomatic side, if we look at from a German new medicine perspective, it's holding on to your crap. Literally. So this is people that have hard time letting go of things. So usually things that were wrongdoings, really things that happened to a person that they really had a hard time accepting at first, and then now just will not let it go. These are often chronic tensions that can develop in the colon. So it's important to remember, like we've said in the past episodes, not just with digestion, but with most things, is to deal with our stressors. So if you make that a priority in life, then what happens is you accumulate less stress in these systems, and then things tend to function a lot better.
Yeah, well, that's a great way to look into it. We can look at what's a healthy colon look like versus an unhealthy colon, right? So when things are going well, so our colons play a big role for our microbiome, which we hear more and more on all these podcasts these days about the state of it. So, and our state of our digestive health. So when our colons are doing well and working the way they should, then we live in a state of, we're doing well. We've got the proper bacteria. We're not getting SIBO. We have not bacterial overgrowth. We're in a good state. So we get healthy, stools. We go regularly. That's a big thing too. So a lot of people will come in that are feeling well. They're clockwork, right? They go at the same time every day or multiple times per day. And the experience is like anything. When things are going well, you're not thinking about it. So that's what you're trying to get to. Versus the contrary is if you're having like an unhealthy, how do you know when your large intestine's not working for you? Well, those are the people that come in with back pain, which we've discussed. They also complain of bloating or gas or cramping, like a lot of that lower abdominal discomfort like that.
Chronic IT band
IT
tension.
band, tensor fascial latte for sure, which relates to your hip there too.
The reason being, so we can tie it in right away. People that have pain down the side of their legs that
Mm-hmm.
are chronically, rolling that out, and it's not having an
It's not
effect.
going.
That entire line is actually the neurolymphatic for the colon. So on each side, the right and left side of the leg, is this band that goes down that is actually the neurological site for the functioning of the organ. So this can be quite sensitive when the organ is not functioning properly.
Really sensitive.
Yeah. So
Yeah.
important to remember, if things like that are persisting, there might be something a little deeper going on than just tension in those muscles. To have it bilaterally too is quite often
Indicative.
an indicator that there is something off with the organ.
Exactly.
And or back so you got to go see, like, where did this start? So back again to our concepts we talk about all the time, going down to the source of what's going on. Is it coming from the neurological system affecting the digestion, which is then affecting your leg, or is it, it can be either or, right? So
Exactly.
And everything in between, in terms of like the like we mentioned, the psychosomatic aspects of how we're dealing with life.
Exactly. So yeah, and then again, if it's unhealthy, then you're thinking, what's the internal state, right? If your microbiome are not where they're supposed to be, which can be, like you said before, some lifestyle stuff. Is it the foods they're eating, the positions they get into, the posture they take? Is it the microbiome itself that they've had maybe too many antibiotics for a long time and they've killed those microbiome? The state's not the same. So generally, these people will have immune issues, right? They have got a
Yep.
lack of immunity. They have inflammation, which is kind of that swelling and stuff, the bloating we talked about. But inflammation would be a big indicator for that as well. And yeah, so that's what you're trying to. Those are the main signs you'll have of someone with a large intestine kind of dysfunction, if you will.
Mm-hmm. Solutions.
Solutions.
Well, obviously, hydration.
Yeah.
Hydration is very important for this system. Um, so obviously, drinking a good source of water can be tremendously helpful. Movement. So moving is so key to allowing that system to get flow. So
Always.
optimizing blood flow and things like that. So, obviously the basics of getting good sleep, to make sure that your nervous system is regulating itself properly, because the root cause of most of these dysfunctions is the fact that the autonomic nervous system is derailed to some degree. So people stuck in a high cortisol state for long periods of time will have issues, primarily with sleep, digestion, and all these types of things. So that's an important thing to remember, which can have so many factors to it. It could be, that you're just chronically stressed and that your nervous system needs some help regulating itself. So that there are many ways that we'll do an episode all on that, I'm sure, coming up soon. How to optimize that, but it's lifestyle habits are primarily the biggest ones. Obviously, your diet,
Yeah.
right? So
Absolutely.
stuff you're eating.
Well, hopefully for the listeners, you can kind of understand, like, there's always something particular that we might need to be addressed, but from things that you can do yourself.
Yeah,
It
huge.
oftentimes, no matter what, comes back to the same things. Are you getting enough sleep?
Yeah,
Are you doing
yeah,
something to help manage your stress?
yeah.
Are you moving enough? Are you drinking enough water? Are you breathing? I mean, it really comes down to what can you do systemically that will help, and your body, when it's working well systemically, can then fight the
Yeah.
local irritations that are there.
It's
And then
huge that you mentioned breathing. Like, that's
huge.
to imagine. We have this like built-in pump that massages this whole area and brings blood flow, and helps regulate the nervous system. So like right there, just doing breath work, like you said,
Pressure dynamics, fluid dynamics.
an easy one to start with is the 4 second in nasal breathing, 6 seconds out. So that from that book, The Oxygen Advantage, which is McEwen, Patrick McEwen. There you go.
I'm gonna say Ian, but I know it's not Ian.
Yeah, I think it's Patrick. Sorry, Patrick. Great book, but that is one like easy method to start regulating your nervous system easier. So that's something you can do right away, is just try and breathe through your nose, 4 seconds in, nice and easy, 6 seconds out. Just help start regulating the nervous system more often. It really is something we have to get in the habit of doing to teach it, because we don't realize how much we teach it otherwise. We're always, on the go and always moving and always, it's not necessarily these stressors we would think of as being detrimental to our health, but it's just because they're kind of chronic.
They're there every day.
Yeah,
And there's multiple or many of them. So they're just kind of spilling into each other.
Yeah.
Absolutely. Yeah. And then, so what are you looking for, like red flags, as far as like if you have a large intestine issue? I would think that any sudden change that doesn't really go away, right? So it's not, if you're used to being very regular and then all of a sudden you become not regular and it stays that way, usually pretty indicative you want to get something looked at, whether from your medical doctor or your therapist that you have a good relationship with. You're just looking for signs like that: bloating, change of digestion, cramping. The big signs that's you're trying to look for. And then our bodies are maps. They tell us when something's not working very well.
Correct. Nice.
All right.
Awesome, man.
Great.
Well, we didn't make fun of Sean as much.
Not nearly as much as we should have.
Well, maybe we'll have to do a second episode.
Just on that.
Just on that. All right, man.
Great.
So good to be back with everyone. Again, Happy New Year to all our clients and
Yes.
amazing staff. And we look forward to seeing you guys again. We'll be back next week with another episode. Not sure which one yet, but we'll surprise you.
All the best in 2026.
All right. Take care, everyone.
Bye.
Ciao.